Great. Thank you so much, Anne, and good afternoon, everyone. It's a pleasure to be here today to introduce UC Healthy Campus Network, as well as UCR Healthy Campus and the work that we've been doing. So I wanted to share a few things, Healthy Campus and what that is. So Healthy Campus at UCR is part of a larger UC system-wide network in which former President Janet Napolitano provided an initial financial investment for each campus to create a culture of health in their respective campus at the UC system. The UC Healthy Campus Network is a diverse coalition across all 10 UC campuses and medical centers, working together to promote individual campus-wide and system-wide changes to advance a culture of health and well-being. The goal is to make UC the healthiest place to work, learn, and live. Okay, let's see here.
Sorry about that. I meant that to be. Let me go ahead and I'll take care of that. So these are our objectives for today's talk, which I realize I placed them in the wrong spot. So one, Julie will introduce Healthy Campus Network and UCR Healthy Campus, which she is currently doing. I will then present on Voicing Collegiate Recovery Project and engagement activities, and then we will have a recorded presentation from a PCORI program officer who oversees the engagement awards, and she will talk to us a bit about how moving from a project like ours to other future research. I'll then report on the forum findings very briefly, and then Dr. Neary will take it over and talk about brainstorm or engage in a brainstorming discussion about future research on collegiate recovery.
Great, thank you, Anne. All right, so equity is an intrinsic goal of the Healthy Campus Network, which encompasses all campus stakeholders. That includes students, staff, faculty, and administration who collaborate to conceive, launch, and study innovations that infuse health into everyday operations, business practices, academics, and work life. Here at UCR, we are fortunate to have the support of leaders like the Chancellor, as you saw yesterday, and you can see in his statement of support. He states, UCR Healthy Campus is a comprehensive approach to elevate health and well-being at UCR. We are committed to the health of our faculty, staff, and students, and embrace an environment that supports and encourages the health and well-being of our campus community. The UCR Healthy Campus provides a framework to bring health and well-being to all aspects of UCR and creates a community where health is a priority. Our goal is to ensure that the health and well-being is the norm, is inclusive of all members of the campus community, and creates a healthier environment for all. So here's a look at the leadership team. Dr. Dean Dees serves as our leadership champion. Dr. Ann Cheney and I are co-chairs. And we also have an advisory committee of students, faculty, and staff that provide direction, leadership, and guidance for a healthy campus. Here you'll see our Healthy Campus vision and mission and the subcommittees in the orange slices in the diagram. Each subcommittee consists of faculty and staff co-leads with membership from all campus constituents. I am proud to say that we have and continue to accomplish so much together through this challenging time. I will be highlighting one of our subcommittees today as it relates to this conference, and that is the Substance Use and Addiction Subcommittee. That subcommittee is chaired by a staff co-lead, Devin Sakamoto, Director of the WELL, which is UCR's Student Health Promotion and Education Department, as well as Dr. Tanya Neary, Associate Professor and Graduate Advisor of Enrollment in the Sociology Department. Here you'll see the subcommittee's objectives. They are to reduce the amount of alcohol, tobacco, and other drugs on campus, reduce harm associated with substance use, and increase safe substance use behaviors among students, staff, and faculty, and also support students, staff, and faculty that are in recovery. Several subcommittee members are in recovery themselves and actively support or research creating a collegiate recovery community at UCR. Here at UCR, we address substance use and addiction as one of our main priorities within Healthy Campus. But throughout the UC system, we have staff experts in substance use and addiction through the Counseling Center, student health, as well as student health promotion and education. We also have faculty experts for substance use and addiction in fields like psychology, psychiatry, sociology, medicine, public health, and education. We also have partners that we work closely with, such as our Employee Assistance Program. Many of these partners actively serve in leadership roles within the UC-wide Healthy Campus Network and are engaged in the efforts to address culture of health and well-being through addressing substance use, addiction, and recovery. It is our ultimate goal to elevate substance use and addiction and recovery throughout our diverse UC community. I also want to mention health equity. Healthy Campus engages in partnered approaches to engage diverse members of our campus community in voicing campus needs and identifying community and structural level solutions to create cultures of health. Several of our UC campuses, including UCR, have begun to address health equity as well as diversity and racism as they presently exist in our campus culture, and to identify actionable steps that we can collectively and individually take to address inequities in our working and learning environments in order to achieve health equity. So now I will turn it over to Anne.
Thank you, Julie. So many of you have likely, over the course of this conference, learned a bit about the Voicing Collegiate Recovery Project, and some of you I know on the call have been part of the various groups that have been part of the Voicing Collegiate Recovery Project. So this is a PCORI-funded award, engagement award. PCORI stands for Patient-Centered Outcomes Research Institute. The ultimate goal of our award, which is a 2-year award, is to raise awareness around and about collegiate recovery, students' experiences, to engage also the perspective of healthcare providers both on and off campus, to build capacity, and that's build capacity of diverse stakeholders, including students in recovery, allies, on and off campus healthcare providers, as well as academics. And then to identify future research. So we have been engaged in this project and this work for now over 1.5 years, and we're at the final stages of the project, you can say. And we are now at the point where we are ready to identify future research. Oh, next slide. So over the past 1.5 years, there have been a number of things that we have done to address the 3 aims of this project. Here we have information about the engagement activities that began about 1 year ago. So actually last fall was when we began our first series of talks and trainings that you can see on the right. There are 3 talks that are identified. We held our initial training in community-based participatory research, and we labeled it as research isn't scary, to really talk about the idea of how can you enter into research if perhaps it's something that you haven't been involved in prior, and how do you think about partnering in research. And in this project particularly, the voice of students really leads what it is that we do, and so our goal was to really have students at the center of everything. And I'm happy to say that we have successfully engaged a number of students over the past year, which has been really exciting for me as one of their mentors and directors on this project to be able to see their growth. And I know many of them are here in this room and have been also instrumental in the conference itself. So that was the first talk. The second talk was on comparative effectiveness research, which you'll learn a little bit more about that as we go through this talk today. And then the third was ethics in research. So really thinking about what do we need to consider when we make decisions to engage in research. And then we also had a webinar and podcast series led by Tanya Neary. And there were representatives from across the UC system, from nearly all of the 10 UC campuses, including student representation, and they were instrumental in developing ideas for a webinar and podcast series. And so what the framework was, the webinar was educational, and the podcasts were represented the lived experiences of students in recovery. And I should say that at all of these activities that we held, we asked people at the end via a short survey, if they were to suggest a topic for future research on collegiate recovery, what would it be? And so over the course of several months, we asked this question and we identified a total of 39 different topics. So the topics could have been vaping, or diversity in collegiate recovery, or addressing barriers, or understanding pathways. And from these, what we did do after is we analyzed them. And so we'll go into that in a little bit. The next slide, Julie. So right now, we've given you a bit of background. We've given you the networks in terms of thinking about Healthy Campus, the Healthy Campus Substance Use and Addiction Subcommittee, as well as thinking about the broader network of the Healthy Campus Network. We'd like to talk to you a bit about the actual award that we received, what type of award it is, and how this award can lead us to next steps. So Julie, if you can stop sharing your screen, and I will share my screen. Okay, and this is from Christine Broderick. She is a program officer with PCORI, the Patient-Centered Outcomes Research Institute. And unfortunately, she was unable to make it here today, but she recorded this presentation, which is about 14 minutes.
Hi, everyone. I'm Christine Broderick. I am an engagement officer at PCORI, the Patient-Centered Outcomes Research Institute. I am delighted to be with you today and excited to hear more about the exciting work that you've been doing. I wanted to share a little bit about PCORI and our work and some ideas and examples that you can think about as you consider your next steps in your work. So I will start by giving you just a little bit of background about PCORI. I am going to switch the screen. So PCORI was created by Congress, by the Affordable Care Act in 2010, to make sure that research would be more accessible and more relevant to patients, as well as their care teams and others making healthcare decisions. And we were intentionally called the Patient-Centered Outcomes Research Institute, and those little words have made a big difference because it means we're specifically authorized by Congress to conduct the kind of research that engages patients, clinicians, and other stakeholders and addresses questions that are important to them. And this is what makes PCORI really unique and what makes the work that we do and the research that we fund different from traditional research. This slide gives you just an idea of the research that we fund, what conditions and populations we study, and the focus of that research. Since we've been funding research, or since we began funding research in 2012, PCORI has invested about $2.8 billion to fund patient-centered comparative clinical effectiveness research studies, which is a mouthful. So I'll say CER or PCOR studies for short. But about $2 billion of PCORI's funding has gone to support about 460 patient-centered outcomes research studies. And these studies compare how well different approaches to care work to find out what works best for which patients depending on their circumstances and their preferences. So I'll talk a little bit about PCORI's engagement awards, which I know you're somewhat familiar with. It's what we refer to as research support. So not for the actual conduct of comparative effectiveness research, but to support the capacity of communities and stakeholders like you all to participate in patient-centered outcomes research. So at the bottom, you'll see the types of engagement awards that we fund. Capacity building awards provide support to organizations to work with communities to increase their ability, their capacity to participate across all phases of the research process. And then there are two others. Dissemination awards support the dissemination of PCORI funded research, and stakeholder convening awards support the communication of PCORI funded research to targeted groups and stakeholders who can use that information. Engagement awards, as I mentioned, help communities get ready to participate in research. Engagement has not always been part of research, but these days we are hearing more and more from researchers that the engagement that they're building into their studies, into their research studies and funding proposals is really making a difference in terms of the work itself and their ability to obtain funding to support that work. And that's really exciting, and it means more opportunities for partners like you to really be making a difference in research. So this slide gives you a little bit of a picture of how the work done in engagement awards to build the capacity of communities to partner in research really fits into the bigger picture of the research that PCORI funds. And of course, not only PCORI funded research, but the broader research world as well. So in PCOR, in patient-centered outcomes research, patient and stakeholder partners are involved in every facet of the work, identifying topics and research questions, preparing proposals, informing the design of a study and the conduct of a research study or how it's carried out, shaping how research results are shared and disseminated and implemented into practice, and evaluating the research and key lessons. And I share this slide just to give you a visual of what engagement can look like. And I know that you know from your work, engagement among researchers and communities can take many forms, and it shows what we've been seeing in our work at PCORI. And I'll share too that how researchers and partners engage with each other varies. It varies based on the study and the design and the approach. Some studies do all of these things that you see on the screen. Some do one or two. But I just wanted to give you kind of a sense of what we have seen in our research portfolios. And next, we already know this, right? Engagement makes a difference. Engagement of patients and healthcare stakeholders in research, it makes a difference. And we know this, but we also now have a growing body of evidence from our research portfolio and the studies that we funded that it makes a difference in these areas that you see on your screen. So over the past 10 years, we've studied engagement in every aspect of what we do. And recently we did a study about engagement in 58 PCORI funded research projects and analyzed nearly 400 examples of engagement influence from in-depth interviews. I won't dig in too much to the details, but the bottom line here is that engagement between research teams and patients and stakeholders really is making a profound difference in all these areas you see on the screen, in getting evidence that actually matters to people and isn't some highly theoretical ivory tower research, but rather is evidence that is useful to people making decisions about healthcare. So you're at an exciting moment in your work, coming out of your 2 years of work on your engagement award, and I know you're thinking about what will come next. So I wanted to share just a couple examples of what some other projects have done building off of engagement awards. And I'll give a caveat. These projects have gone on to secure additional PCORI funding and be part of PCORI funded research awards. That's not always the case, or not always the next step for engagement awardees. And frequently it's not, but there are so many opportunities for awardees who have completed their engagement awards. And I chose these studies because I think they help to demonstrate a path from the work that you're doing in an engagement award to partnership and shaping research studies, whether it's funded by PCORI or elsewhere. So this first study is the Tulumbe project. And this project was focused on developing solutions to end the HIV epidemic among the African immigrant community. So the rate of new HIV infections is higher among African-born Black women in the US. But there are no evidence-based HIV prevention interventions that are specifically designed for African-born women. So to address this gap, the Tulumbe project, this partnership of African-born patients and stakeholders, was funded by PCORI to engage patients living with HIV and stakeholders in the African-born community to address HIV disparities. So this project started out with funding from PCORI's Pipeline to Proposal Awards, which funded groups of patients, caregivers, and others to come up with ideas and proposals for research based on what's important to them, instead of researchers and scientists always driving those research questions. And after this initial funding, this project also received engagement awards. And with those engagement awards, they built a large patient-driven research network. And a key focus of that network is to build the capacity of African immigrant community members and organizations so that they're prepared to collaborate with academic researchers and empowered to use PCORI methods to address health disparities in their communities. The project undertook a number of activities, including community forums and other ways of engaging with stakeholders and with patients. And through this work, they identified 6 priority topics for ending the HIV epidemic among the African immigrant community, as well as research questions to go along with those priorities. And the goal was to encourage researchers to study those important areas. So this year, the project is partnering actually in a large PCORI-funded research study to compare individual versus group level interventions to reduce HIV risk. So that's really exciting. And the aims of this study that they're involved with now directly reflect the priorities that were identified by this group. And patient and community partners from this project are playing an important role as key personnel in this study. So they'll be continuing to contribute to this work. To give you another example, a researcher named Dr. Angela Smith partnered with the Bladder Cancer Advocacy Network for 2 engagement awards. So they worked to prioritize the research questions that were most important to patients and caregivers. And they developed the Patient Empowerment and Engagement Research, or PEER program, to support patients to participate in research teams. And again, the goal was to link these patients and stakeholders, this network, with researchers who may not have been involved with patients already, and really to facilitate their engagement in research across the country. As it turned out, this area, bladder cancer, was identified as a priority by PCORI, and Dr. Smith now actually leads a large pragmatic clinical study that's focused on one of the priority areas that was identified by this network. So again, very exciting work, and another example of, a possible next step for engagement awardees. So on this next slide, I wanted to share just some resources that we have available if you're interested in pursuing additional PCORI funding. These are some areas of our website that you can check out. We always recommend reading through these funding opportunities that we have available and exploring some of the guidance and FAQs and possibly scheduling a conversation with PCORI staff before taking the step of preparing an LOI, a letter of intent, because that's obviously a lot of work. So we would encourage you to check out our website and explore these opportunities. I will also share some engagement-specific resources, which you'll see on your screen here, and they're linked within the slide. And these may be helpful to you as well. And finally, this is a new learning package that we just released a few weeks ago called Research Fundamentals. And this is it's a training that's on our website. It's on demand, so you can go and get started and pause and explore at your leisure. But the goal of this learning package is to help patients and stakeholders to understand what we call the language and the logic of the research process and be able to engage and contribute more confidently. So that's a very exciting resource that we encourage you to check out. So with that, I will say a big thank you. You're doing very exciting work. We at PCORI have really enjoyed following this exciting project, and we cannot wait to see where you go next. So please keep us posted, and we hope you all will continue to stay engaged in this very important work. Thank you so much. And if you have questions or you'd like to reach out, my contact information is here at the end of the slides, and I look forward to hearing from you. Thanks so much.
Okay, thank you. So Julia, if you could go ahead and share your slides. I'll just make sure that this is not up. Okay, so just to reiterate, we did have a PCORI engagement. We do have currently a PCORI engagement award. Our award ends January 31st of 2021. So we are nearing the final stages of this award. And Tanya will talk more about the research next steps in terms of a work group that we will be developing. But we want to talk to you about our forums that we held. So I mentioned earlier that we, at the end of our all engagement activities, we asked people if there were one topic or a topic that you would recommend we focus on in the fields of collegiate recovery, what would that be? And there were 39 different topics. We held, which is part of a deliberative democracy forum process, we held framing sessions. And these framing sessions were an opportunity for people to take a look at those 39 different items and to think about what broader categories they represent. And so at the end of the we held 3 framing sessions, we were able to identify 4 different categories. And those 4 different categories included pathways to recovery, barriers to recovery, campus contributions to recovery, and then polarized ideas about substances. So the next step in the deliberative democracy process is to take that information, those issues is what we call them, those 4 topics became issues, and we then invited individuals from 4 different UC campuses to engage in a process of deliberation. So across the 4 different UC campuses, we had a total of 77 people who participated. They included students, faculty, staff, administrators, healthcare providers, and then others who identified as being part in some way, directly or indirectly, of the field of collegiate recovery or the field of substance use treatment. So during the deliberation, again, this was virtual. Originally, we planned to do it in person, but we did it virtually, which I think worked really well. We had trained student facilitators, some of whom are on this call today, who facilitated small group discussions or small group deliberations. During the small group deliberations, for each of the 4 issues, they asked participants, why should we focus on pathways to recovery or barriers to recovery? They then asked, what are existing strengths and resources in our community that can be used to conduct future work on campus contributions to recovery or polarization of substances? And then the last question they asked are, what are some of the barriers to conducting future work on said topic? So Across the UC system, we had multiple small group deliberations that we then took all of this information and we analyzed it. So we recorded everything, we transcribed it, we had text essentially of the responses that people provided during the small group deliberations, as well as what happened after the small group deliberations during the same session, the forum. We then brought people back together and we had a spokesperson share information that was deliberated during their group. And so we not only have small group deliberations, but we also have these large group discussions about what was deliberated in the small group discussions. So next slide. And what we asked at the end was, if we had to choose only one of the 4 issues, which one would it be? And we asked this not only in the large group discussion, but we asked it individually when people completed the survey. And why I think this was important was because people had the opportunity to collectively say what they thought was the best choice if they had to choose only one. And then we continued to discuss it in a large group setting. And the responses actually varied a bit, but ultimately we decided upon utilizing the survey responses in which more than half of the participants indicated a focus on barriers to recovery, which really, when we think about the conversations from the deliberations across the 4 campuses, small group discussions, consistently this is what we heard. If we were to recommend that you move forward with one topic, it's barriers to recovery. So why? Why should we focus on barriers to recovery? The idea really is to provide equal access to recovery resources. To do this, we need to first understand the barriers to accessing recovery resources and support. So potential topics for future research could include things like spaces and programs for underrepresented students, stigma connected to recovery in the collegiate environment, different programs, making comparisons amongst the programs such as peer support, mental health programs, which include recovery, and then non-faith-based programs. As well as another potential topic could be education for faculty and administration. When we think about the strengths, what people consistently said is that research can build on previous research and engage faculty of diverse disciplines, and that we can engage academics and on and off campus healthcare providers in the process of conducting the research. However, there are some barriers that we collectively identified. One is researcher capacity, the engagement of students, specifically students in recovery, administrative support, and then limited funding. So in the words of participants who partook in the deliberative sessions, one participant commented, barriers, specifically to working on barriers to recovery, could be just the capacity of faculty, staff, providers to have the time or the budget to conduct the research, or whether the campus administration felt this is an important topic. Another participant commented, maybe the people won't feel fully comfortable or fully honest with their research answers that they will give. So this could lead to a low number of participants or some stigma that could influence the research process. Next slide. So I'm going to hand it over to my colleague, Tanya Neary, to talk about next steps.
Hi, everyone. Thank you, Anne and Julie. Yeah, so this next part, I'm going to present some information. And, you know, because when one presents information, one has to make certain choices about how to frame things. You know, you'll see the way I'm currently thinking about it. However, I want to be clear that what my role here with you today is to brainstorm research topics. And so if you think about the topic slightly differently than the way that I have framed that, I want you to know that that's okay, and you can speak up and express that. And you'll see what I mean as I go forward here. So, so now that we know what the Collegiate Recovery would like us to study, our task is to develop a study on that topic of barriers to recovery. And as the representative from PCORI indicated, what PCORI is interested in is research that compares the effectiveness of approaches And so, so the type of research we need to propose on barriers to recovery will compare efforts to address barriers to recovery. And so it's not more information about what are the barriers per se, but it's more like what works to address barriers for recovery. So that is kind of the best way to think about comparative effectiveness research. It answers the question, what works to address a particular issue? So we are going to brainstorm a little bit about not so much a topic, right? Because we know the topic will be barriers to recover, but the sort of specific details about what would a study on barriers to recovery look like? What populations should we collect data from? What kind of data should we collect? And then, of course, since we want to answer the question, what works, what are the strategies that we will implement and compare the effectiveness of? So the other thing I want to share here is that a study on collegiate recovery could look, there's a variety of types of studies we could do, right? So it may involve gathering additional information and then translating that to intervention. So, you know, we know we want to study barriers, so maybe we need a few more details to pick the right intervention to implement and evaluate. So you could have a study design where you would say, well, let's gather a little bit more information about the specifics of barriers to recovery, and then tailor an intervention and study the effectiveness of that intervention or two interventions or something like that. You know, or you could envision a study design where you would identify at the get-go approaches to barriers to recovery and then compare their effectiveness, where you don't need to necessarily collect additional information. So, you know, that's more another way to think about how do we go forward and options that we have. Next slide, please. So, yeah, so we know that the broad topic will be about barriers to recovery, but we also know that themes that came up throughout all the topics, which means we should probably focus on them when addressing barriers to recover, involve stigma and diversity, and in terms of diversity, both racial, ethnic, but also diversity within the recovery community in terms of people's substance use and recovery pathways. And then other issues that came up were ideas about infrastructure, administrative support, and recovery resources. So we can think about, you know, one thing we can start with for brainstorming is this idea of whom would we focus on, what population or sample would we focus on in order to conduct comparative effectiveness research on barriers to recovery. And, you know, one option is to focus on people in recovery. And a number of ideas come to mind for that. So because we recognize that there is diversity in the ways described earlier, we could investigate approaches to tailoring outreach and intervention to particular subgroups within the recovery community. And that idea is actually, you know, exists in a lot of different other spheres. So for example, in medicine, you may have heard the terms personalized medicine or precision medicine. Basically, those are ideas are that, you know, the particular treatment for a given problem must be tailored to the individual, given the individual context. In the case of medicine, they factor in things like genetics. But if you're thinking about in the case of recovery, it could be to a particular cultural, racial, ethnic subgroup or a particular recovery pathway. For example, in some of the sessions, we've talked about the difference between abstinence-based recovery and alternatives. Yeah, and then the other place that you see this idea in terms of tailoring is in a lot of prevention and health promotion. So this idea that each person has a different constellation of risk factors. And so rather than create a single kind of approach, what you do is you create a toolbox, and based on the individual person's needs, they would get various tools applied to support them. Also related to this idea of focusing on barriers to recovery in the case of people in recovery, another idea is interventions or approaches that might build community within community. So we have recovery community, but there's diversity within that. And so what are the ways that we can build community, subgroup specific community within the broader recovery community? And what are the ways that we can build and maintain the collegiate recovery community in the broader community of the university? And so we can think about, you know, what might be the approaches we would investigate the effectiveness of for doing that. Instead of focusing on people in recovery in the study, we could also focus more broadly on people on campus. And we could focus on everybody, or we could focus on subgroups, administrators, health providers or student services support, or faculty, peers, students. And there's, in terms of types of approaches in research to this idea, there are a variety of interventions that engage in social marketing to reduce stigma. So those are basically campaigns to educate people. In this case, we would look to develop or draw on an intervention that would reduce stigma associated with substance use recovery. Let's see, what else did I want to say here? I'm also thinking about interventions that would focus on individuals to reduce stigma. So I'm thinking about Bruce Link's talk on stigma, and he identified, kind of individual focused ways of reducing stigma. And one of the things he talked about was this idea of empowering people to challenge stereotypes. And certainly in the intervention literature, there's a lot of interventions out there for other social problems like bullying prevention, sexual assault prevention, that draw on empowering bystanders to reduce stigma by intervening when they see people make disparaging remarks or express inaccurate information. So those, I don't know if I said the term bystander intervention, but there are intervention approaches that take that effort to educate people about the problem, in this case, stigma related to substance use recovery, and then and give them tools for reducing that. But what also came up in sessions in the conference this weekend is the potential for mobilizing the campus or members of the campus in order to change policy, in order to institutionalize collegiate recovery as a key pillar of student services support. And so that would have to involve more than just the collegiate recovery community. It would have to involve allies from throughout the university and across campuses. And so that might be another potential thing that we could focus on. So these are by no means mutually exclusive. We don't have to only focus on people or recovery or only, the campus at large. Let's see. So maybe I'll pause for a moment there and just say, what do you think? What do you think? What ideas do you have? So you can either put a comment in the chat or I guess raise your hand, right, Anne?
Yeah. I don't know if there's the raise the hand function. But yeah, feel free to put a comment in the chat. Or unmute yourself and speak up.
So I want to be clear that there's no pressure. It's not your job to have the correct answer. That's our job, to continue to work on this and get input. But this is an opportunity for you to react initially. If you were going to pick, if you had to vote today, what might you suggest we focus on in order to address barriers to recovery?
Family intervention, maybe?
Okay, can you say more about that? So to reduce family as a potential barrier?
No, to increase their participation in the student support, in the student's recovery process.
Excellent, Ruby. And so if I understand you correctly, that then the barrier we would be focusing on would be sort of lack of support in the recovery process. And so by
Yes.
engaging families. Yeah, and I thank you. That's an excellent suggestion. And you know, one of the issues with campuses is that students, well, all of us, we all have families, but we think of them as often, for most of us, they are not on campus with us, right? There are some few exceptions to that, right? Like we have student parents who may live in family housing on campuses, but so that could be something we could look into, is how do services that are already in existence, or you know, if we were to develop new services, what is the extent to which and the strategies they use for engaging families in students' recovery? Thank you for that, Ruby. Other comments? Stephen Sussman is sharing, for example, I pay all this tuition money, I want privacy for my youth. Yeah.
So can you kind of clarify the question again for me? Because I'm sorry, I am multitasking. But it says,
no worries. Yeah, no worries at all. So, so we know we want to go forward and examine solutions that reduce barriers to recovery. So the question on the table is, what specifically should we focus on? And one way to think about that is, should we focus on people in recovery, and like what would specifically help people in recovery? So an intervention that kind of targets their particular navigation of barriers. We could focus on people on campus, or as Ruby suggested, and sounds like Stephen Sussman agreed, that maybe we also need to look at people off campus, right? And the campus's involvement of family in supporting students. And then, so that's one question, is like, who should we focus on with choosing a strategy to reduce barriers to recovery? But also we have a lot of options in terms of what strategies we employ. Should we try to reduce stigma? Should we try to build infrastructure? Should we try to change attitudes?
well, you know, I'm listening, and I'm thinking that, you know, there are the students that are on campus that have barriers or have maybe recovery issues, but there are so many off campus that have issues. And you could think about a lot of them that want to come to the university, want to come to college, want to change their lives, but they don't know where to start. And because recovery has stigmas, it's difficult. So I don't know if I would say we would base some studies on people, our students, our wannabe students that are in and around our college campuses, especially around the college campuses, because the ones who made it, we are still here working towards making it better. But the ones who want to make it, I think those are the ones we need to work on. There's a lot of young people that are doing drugs that back when I was a teenager wasn't doing that many drugs. You know, I'm older, I'm a non-traditional student. I came back and here I am today. But I think that we have, it's a wide range of students, people that we have to focus on. So, and the barriers, we know the barriers are there. There's so many barriers, but which ones do we knock down? I think we should knock them all down if possible. So
You're here. Thank you so much, Demetrius. I think one thing, you made so many good points. One thing I'm hearing from you is I need to add to this list. There's people in recovery on campus. There's people on other people on campus who may or may not be in recovery, but then there's people off campus who maybe want to be on campus. And so what are the barriers to engage, to bringing people into the university, which at the same time can bring them into recovery and or support their existing recovery? So that's a helpful thing for us to consider also. And we could certainly look at how universities advertise and recruit and what information do they share about their services, and the ability to be on campus and be a person in recovery. So that's a great point. Thank you.
Thank you.
Okay, I'm seeing comments in the chat, and Anne, I'm hoping that you will let me know when I need to move along.
Okay.
So
you're good.
it's saying basic needs, rest, mealtime, meditation time. Because when students are in their active addiction, they are not taking care of their basic needs, right? So, yep, so focusing on basic needs in the list that you provide there, Ruby, thank you. And William reinforced this idea of not just focusing on families, but also family stigma related to families' views of recovery. Yeah, thank you for that. I don't know if there are comments up above. Yep.
Tanya, can you hear me?
Yes, Gina, go ahead.
Yeah, what keeps on going through my mind as we listen to all this is just mentorship, institutionalizing mentorship throughout the campus at all levels. And to kind of piggyback what Demetrius was saying was also reaching out to people who are not on campus. But if we have an identified group of staff, professors, physicians, social workers, students, grad students, undergraduate students, just to institutionalize and to kind of look at outcomes, somehow form a study around that, comparing, because some of what I heard earlier in the program was mentorship really changed lives for people. And I know it changed for me, as I went through my entire process as a woman of color. So anyway, that's what keeps on going through my mind. I don't know if that's helpful.
It's absolutely helpful. Thank you, Gina. Yeah, and so in that way, that seems to be an approach where we would be doing both, focusing on people in recovery, but connecting them with people on campus. So that's great. Thank you. And I see Demetrius is giving a yes to that. Thanks for that input. Other comments or suggestions or thoughts?
I had an idea. I'm not sure if student from the BCR team can bring up.
Great, Armand, go ahead.
When we were doing the facilitator report, one thing I noticed was a lot of the different UCs that we looked at, they had different levels of administration support. So someone like UC Santa Barbara had completely different kind of administration support than LA or something like that. And I noticed maybe there is a connection between that and potential stigma that, and how many students maybe use the services that they provided based on how much support they received from the administration, if their programs are actually, well funded and all that.
Yeah, thank you. I agree that is definitely an area for potential for research, right? So, and I think that for me, I kind of was trying to capture that a little bit in this last bullet on the slide here with this idea of policy, which is how, in terms of an intervention, how do you mobilize support for infrastructure and administrative support, and then how does that then translate to, but I think you're also raising the possibility of, making a connection and trying to understand how the level of administrative support may be tied to the level of stigmatizing experiences on the ground, and that actually the two things might reinforce each other, right? Stigma sort of at the administrative level might be why there's not very much support, and then that leads to people not having as many resources that would reduce stigma or enable people to manage stigma and manage recovery. So thank you for that.
So Tanya, I just want to share that on the WOBA chat, there is a comment about a need for an ecological model, which I believe that was brought up during the meeting with, or the session with Dr. Denise Woods and Dr. Jeannie Kim.
Right, they talked about kind of trying to create a holistic approach. And so I would love to hear more, whoever made that comment, about exactly what you would think that we need to study. But one idea I have that you could perhaps react to is, we talked about in that session with Denise Woods, this idea that you know, how do you get collegiate recovery to fit within that holistic view of care? And so, for example, some of the ideas that they talked about were, you know, redefining collegiate recovery to be part of basic needs and part of mental health, because those are already fully funded. You know, they have support. I mean, of course, everything could always use more money, but there's an infrastructure, there's support, there's paid staff, and so on. And so for me, again, that's what I was trying to capture in this idea of somehow policy movement, because they were really advocating that, you know, that occurs at the policy level. You have to change the policy and so that then collegiate recovery becomes defined as an essential service of the university, or an essential, you know, area of student wellness that the university invests in. But I wrote that point down about the ecological model, and sort of partly part of the idea may be mapping what aspects of the ecological model have been mobilized on a particular campus, and where might there be gaps.
So Tanya, there's that question in the chat from Steven Sussman. So
yes.
Yeah, do you want me to read it?
Sure, no, I can read it right here. So the use of online menu of support options that students can utilize. That includes a wider variety of recovery options, including individual-based, mentoring or group-based, secular or meta-religious approaches, website provided to students first semester, among other services for students. And maybe that's done already. Yeah, so that's a great idea. So that goes back to that idea of maybe creating a toolbox, right? And approaches that create a toolbox that allow for tailoring. Yeah, so that's great. That's kind of an intervention approach then, that's more about not just implementing a single kind of program, but making sure that an sort of a recovery support approach has multiple pathways, multiple programs or options. Yeah, and as Dr. Sussman is mentioning, that you could include that, you know, advertise that, you know, through first year orientation to all the students, but also have an online service for that. I do know we have a bunch of stuff online for our students, you know, but you know, I think part of what we're learning is that campuses vary, right, in terms of what they have that is collegiate recovery focused versus sort of generic sort of support services, which can be helpful but may not be helpful if people are looking for a kind of an application of that to the context of collegiate recovery. So, okay, that's great. I'm writing that down. Any other comments or suggestions? By the way, can I just say shout out to Steven Sussman? I'm familiar with your work. It's great to have you here.
Okay, so I just want to make a comment. So
excellent.
So I was reading from Miss did I say your name right, Miss Ann? And I had text her, but I won't put everything out. So when you have someone or you meet someone, and you want to help them, okay, and she talked about mentoring. It would be great to have people out there, but when they don't trust and they're scared and they don't want to show, they don't want people to know that they have these struggles with drinking and drugs, but they try to come to school, and you know, I don't know how to, I don't know how, I try to help, but I don't know how to get them to the right people. That's the issue. Are you guys, is this listed in resources? Yes.
So yeah, so I hear you, Demetrius. What you're saying is important, if I hear you correctly, is that it's kind of, when there's a gap between the existence of resources and the people who need them, we need to have a way to bridge people, to get people to the resources and make sure that they know about the resources, but anybody who that person might interact with, right?
Right.
Yeah, that could be part of what we study, which is how is information about available resources distributed? And, you know, like even the mentoring idea, you know, can we educate mentors to provide general support, right? But also to be specifically informed about collegiate recovery resources.
Yeah, because
Am I getting that right, Demetrius, what you're highlighting?
Yes, you're right. But I'm just trying to get past, like, when you want to help, but you're afraid of what people might think. You know, people they're afraid of what people might think or say or whisper behind.
Right, and so that's part of what you're addressing.
Their backs.
I think is that
I don't know, but I've been trying. Yeah, the stigma. So, and it's like a jacket. You know, this you wear this jacket and you want to take it off, but you don't know how or where to take it off at. So that is an issue.
Yeah, and I think that's part of that is an option for us, is to study strategies, the effectiveness of strategies that might reduce that feeling. What are the factors? What types of interventions would what do you call it, embolden or enable people who are wanting information and wishing to access services? What's the context in which they will do that, where they feel safe to do that? You know, and so part of what we may need to do is implement strategies that educate other people so that when somebody comes to them and seeks a service, they get a positive response rather than perhaps a stigmatizing one. Yeah, that's helpful. The word navigator comes to mind. I know in medicine, you're seeing a lot of this, and in social work places, they have people that they hire to be navigators, right? Where they say, you know, I'm here to help you get to where you need to go. And so rather than saying, oh, here's 10, you know, resources, go investigate them, they will sort of help you go through that list and figure out what's best for you. That may be an option too.
So I just wanted to comment on this because I think there's, you know, a couple different things. One of which is this peer-led or navigator model. What resources or knowledge do people need who might be in this more bridge role or navigator role? And do they experience, another component of that, do they experience issues of stigma or trust or fear of sharing information with those who may need that information or connection to services? But also people who are struggling with substance use, they might experience fear and distrust or have concerns around trust. Who can they trust?
Yeah, see in the comments, Stephen Sussman points out, you know, when you disclose, people may then, you know, draw conclusions about you, you know, and so how can we address that? Yeah, so that's helpful. Well, I want to be mindful of time, so we have an opportunity for maybe one or two more suggestions or comments or reactions, and then I can let you know where we're going next. So Armand is sharing that another barrier is this idea of awareness of the programs available. And it may be that a lot of individuals in recovery may not attend recovery because they don't realize it's an option for them. Yeah, so information dissemination is a huge issue. Yeah, and I think, so it's almost like flip sides of the same coin. There's, do you know what's available? And then how do you feel about the possibility of reaching out, you know, going to access it? What are your concerns about going to it and how people might react to you? So yeah, thank you, Armand, for that. I got that. All right, well, information access. So Julie, could you move to the next slide, please?
Seems like my slides are stuck.
Maybe we're meant to keep talking about this topic.
But
the reality is, well, what I can tell you, the reality is that's what the next step is. We're going to keep talking about this topic. So my job is to convene a research work group. So right, everything we've done up until now is like, what should we study? And now we really need to get more specific about how we're going to study it and pick a research design And so what we will do is, part of what we'll do is we'll certainly turn to the Voice and Collegiate Recovery network that we have established, so people who've already been involved in the project in the engagement portion, but we'll also engage people from across the UCs, like through UCR's local Healthy Campus, as well as the UC Healthy Campus Network, which is all the other campuses' Healthy Campus programs on their individual campuses. And then, I put that last bullet there for, is there anyone else you think we should be connecting with? And you can speak here about, and I should say that the VCR network, the Voice and Collegiate Recovery Network, is pretty huge, right? We've got, all of you are now part of it if you haven't been previously. So we have students and faculty and scholars and community practitioners in that network. But perhaps there are specific people you think that we should be including in this particular portion of the project. People who could help us, guide us in designing a study, So if you have any suggestions, we are open to your thoughts now. And maybe you could say, oh, talk to the people at this center, or here's this one person. And if you can't think of anybody now, but it comes to you later, you can certainly communicate that information with us at any given time. And you can email me, or you can email Anne, or send that information through the UCR, all the emails that you have already about our project.
Okay, I think our final slide, Julie.
Thank you.
So thank you, our UCR Healthy Campus team and our Voice and Collegiate Recovery team. So if anyone wants to get in contact with us, particularly if you want to get in contact regarding Healthy Campus, feel free to reach out to healthycampus.ucr.edu. You can connect to also the Voice and Collegiate Recovery work via the Healthy Campus email address, or you can reach out to me directly. I would be happy to entertain any questions, meet with people. Of course, we'd include other members of our team. Just thinking about next steps, as Tanya already shared, we are going to continue this conversation, and specifically what that will look like very soon is research work